Washington, Alex M. Azar II, President Trump's nominee to lead the Department of Health and Human Services, has expressed concern about the soaring cost of prescription drugs for many consumers. This week, Mr. Azar, a former pharmaceutical executive, is expected to face tough questions at a Senate confirmation hearing over why his own company raised prices. Democratic senators say that, as a top manager at Eli Lilly and Company, he was responsible for steep increases on insulin and other drugs. How he would now tackle that problem as secretary, along with the future of the Affordable Care Act, promises to dominate the hearings. Even Democrats who are unlikely to vote for Mr. Azar say that he will probably be confirmed, and that he would be more pragmatic and less ideological than the man he would succeed, Tom Price, who resigned in September under criticism for his use of private jets and military flights. And Mr. Azar has struck a conciliatory tone as the public outcry over pharmaceutical prices has grown. "Let's start by saying, we have a problem," he said at a pharmaceutical industry conference in May. Mr. Azar, 50, would bring an unusual combination of experience in government and industry to the job of running a cabinet department that spends more than $1 trillion a year providing health insurance to more than 130 million Americans. His resume is studded with conservative credentials. He was active in the Federalist Society and was a Supreme Court law clerk to Justice Antonin Scalia, whom he describes as one of the 10 greatest figures in the history of Anglo-American law. He spent 2 years working for Kenneth W. Starr, the independent counsel who investigated President Bill Clinton. He worked on the Bush-Cheney campaign in 2000 and provided legal support for vote recount efforts in Florida. Mr. Azar, who describes himself as a policy wonk, joined the administration of President George W. Bush as General Counsel of the Department of Health and Human Services in 2001 and became Deputy Secretary 4 years later. He helped devise the legal rationale for a complicated compromise on the emotional issue of federal funding for embryonic stem cell research. And he helped carry out a 2003 law that added a prescription drug benefit to Medicare, one of the most significant changes in the history of the program. Work on Medicare was a formative experience for Mr. Azar, and he cites the drug benefit delivered entirely by private companies under contract with the government as a model. The cost to Medicare beneficiaries and to taxpayers has been substantially less than originally projected. Mr. Azar, rhymes with Payzar, joined Lilly in 2007 and worked there for nearly 10 years before he left the Indianapolis-based company in January of this year. Lilly's portfolio includes Cialis, for men with erectile dysfunction, Forteo, for osteoporosis, and Zyprexa, for schizophrenia and bipolar disorder. But its best sellers are insulin and other products for the treatment of diabetes. Patients and members of Congress criticized increases in list prices for insulin while Mr.